teeth be making you sick? We all know that bacteria in our mouth causes cavities, but have you thought about root canals? And what about having your wisdom teeth taken out? Did you know that these are both breeding grounds for multiple bacteria? So bacteria and the toxins that they produce can cause disease.
It's a big problem, and it's not one that's widely accepted in mainstream dentistry. It was back in 1909 that Weston Price, the dentist at that time, studied this and did extensive studies on it. And he presented, or his family presented, Dr. Hal Huggins with this information back in 1986. And at the time, Dr. Huggins didn't know much about what was in those papers, but he was stunned when he saw how much research was done showing that these infections that are in the presence of root canals and cavitations, which are the places where wisdom teeth have been removed and what's left, are major issues in our health.
This is amazing to me that this has been ignored since 1909. They've known about this. And what's the Dental Association say now?
Not much. And a lot of it's recommended around arrogance and about being naive and thinking that they're just right because that's what's been accepted as what's going on. And it's also about money. You know, once the status quo is in place and it has a technology that it uses, it holds on for dear life because it doesn't want to disappear, because if it does, it's going to lose all the income that goes with it. There are probably about 90, close to 90 different microbes that are found in cavitations or root canals. And those particular bacteria, interestingly enough, can produce up to 5 different kinds of endotoxin, which is what makes us sick. And that depends on what the environment is like, that determines which endotoxin or how many endotoxins are going to be secreted by those microbes and cause the problems with our health.
So let's define what a root canal is and the accessory canals and the tubules so that people can really understand why this is such a problem.
Fair enough. A root canal is usually done when a tooth is in pain or where there's a clear infection, and very often in the root of the tooth. And very often what the dentist will do is they'll x-ray your mouth, and if they see a dark place where there's resorption of bone, where the tooth is held in place by the bone, they'll say, well, there's an infection there and we need to do a root canal. Now, if there's a lot of pain there, no question. And sometimes they're absolutely right that when there's this dark space there is infection even if you don't have symptoms. But that's something that is leading to doing these root canals so they can get rid of the infection, so they think. So they go down and drill a hole in the tooth right down to the root, take out the nerve, so now the tooth is dead, and think that they put a little gutta percha in there, which is the kind of wax that they use to seal off, so they think no infection from the inside of the tooth can be a problem, keeping in mind that there are miles of tubules in the dentin of the tooth that are impossible to sterilize with something like gutta percha. So what we have is a situation here where a lot of microbes are breeding grounds inside those miles of tubules, and they continue to express themselves, increasing their volume, and they ooze out into the surrounding tissues. And that's why when a tooth is removed that's had a root canal, you can see a little pocket of pus at the tip of it. There's a lot of infection, and in someone who's not got good health, that can be a major factor. What Weston Price found and Hal Huggins found was that when they ground up those root canals, that every one of them was infected. And the tip of every root canal that was there had some infection at the tip as well. So the tooth is infected, the tip has got a little pocket of pus, and that is what's causing some of the things that we're seeing in medicine today.
Root canal treatments are performed when the pulp inside the tooth has died or is dying, usually as a result of either the ingress of bacteria associated with decay or cracking or fracture of the tooth. The dentist aims to clean out all the root canal system and then obturate it using a rubbery material and a cement. This is challenging in itself as the canal system is very complex with lots of interconnections, additional canals and lateral and accessory canals, which make the job almost impossible. However, the insurmountable issue appears to relate to the structure of the dentine itself. Dentine is composed of millions of tiny tubules, which in health are occupied and maintained by the cells that form the dentine, known as odontoblasts. When the tooth has died or been root-filled, these odontoblasts and their supplying vessels and nerves die, and when the tooth dies or is root-filled, the conditions within the tooth change radically from aerobic to anaerobic. Any bacteria within the tooth morph into their anaerobic forms, reproduce prolifically, and produce extremely noxious toxins. The tooth effectively acts as a microbial hatchery, since it provides nutrients, moisture, and incubation at body temperature, but critically prevents the immune system from tackling the source, since there is no circulation to the tooth. The bacteria and their toxins leach into the surrounding bone and membrane, and the pumping action of the tooth within its socket when chewing causes dispersal into the circulation. In this way, the tooth acts as a focus of infection, which can infect and poison the rest of the body. Every root-filled tooth has been found to contain at least 10 species, and some in excess of 40 microbial species, but it is probably the toxins they produce that represent the greatest issue, some being 1,000 times more toxic than botulinum toxin. In addition, retention of a dead and infected body part can exhaust the immune response, leading to autoimmune diseases and chronic fatigue, and can affect meridian flows, and there is a particular association between root-filled teeth and cancer.
Dr. Mercola say it isn't true. 97% of cancer patients have previously had a root canal. You got to be kidding. I've provided the links below, but basically Dr. Mercola in his video explains about Winston A. Price, a pioneer dentist that had proved that these things are totally unsafe over 100 years ago. And the dental associations have done everything they can to discredit the man and the man's research, but he was brilliant and he was right, and people are dying because of it. These root canals are basically keep a dead tooth in your mouth, and the roots cannot get oxygen to them, so they become anaerobic and septic, and cause prolonged infection and pain. Now, I'm not saying that all dentists are bad and all dentists are in on this thing, but it damn sure looks like they're part of the population control group. At least some of them are, and I wish they would take a look at what's going on. And look who's going to be providing your health care here pretty quick. So take a look at the links below. It's real important. I'm getting ready to get a root canal yanked, and probably some fillings too. God bless. Take care. Don't let these suckers kill you. Bye-bye.
Hello, this is Dr. Mercola, and I welcome you to another question and answer video update. Today we're going to focus on the question, what do you do if your dentist recommends a root canal? Let me expand on the root canal issue, because this is an important area that we see in many of our patients, and actually is an important cause of energetic dysfunction that can cause serious disease in many people. So I do not recommend root canals for anyone, and the reason why, and you can expand on some of the details on this page, but basically your tooth is composed of many miles of very tiny canals, and when the dentist takes out that middle cavity or middle central section of the tooth and seeks to sterilize the tooth, it is physically impossible to sterilize it. So what winds up happening is some bacteria wound up getting caught in the tooth, and then when it's sealed, these bacteria are then encased in an anaerobic or oxygen-starved environment, in which case these bacteria mutate into forms that they were never designed to be, and can actually secrete toxins, and depending on which tooth has the root canal, it can cause quite severe health dysfunctions in the person who has it. So that's why I don't recommend them. So if you don't have a root canal and your tooth needs to be extracted then, because you don't want to keep a dead tooth in your body. There's no other organ in your body that any health professional would ever recommend keeping a dead dead organ in.
And I noticed that you mentioned you're having a guest talking about root canals.
Mm-hmm.
That's a show that everyone needs to listen to because root canals are almost the cause of about 2/3 of what walks in the door from people that have been to 5 different doctors and no one knows how to fix them. But I'll let your show on Friday talk to that.
Yeah, that's Dr. Gerald Smith, and he's doing a lot of great work on root canals. And I've got a root canal myself, and I'm in the process of figuring out how to get rid of that in a safe and effective way.
You need to pull the tooth. If you've got a tooth that was able to die, the secret is not to embalm it and leave it in your mouth. The secret is to pull it and clean out the socket. Because what happens is you get an autoimmune reaction against the chronic infection that the root canal causes. And that's the cause of most of the things that we deal with. And the way to treat it is small amounts fix what large amounts cause. If you have a known problem, you use a dilution of it, and it triggers the immune system to undo the problem. And you not only have to use the same thing that you find, you use something similar to it. That's the secret of homeopathy.
Okay.
We can talk about.
And just one more thing on the root canals. Have you heard that there's some sort of lowering of the immune system just by having one root canal? I believe I forget what percentage it lowers your immune system, but it's an incredible amount, isn't it?
Well, let me just tell you that, I see the path reports from the removal of the infections that are underneath the root canals. I mean, they find as many as 12 or 13 different bacteria and viruses in a root canal tooth.
Wow.
And when the immune system is being challenged to fight 12 or 13 different infections, that lowers and destroys your immunity tremendously. And that's where a lot of chronic illness comes from.
Wow.
And the thing is, you need to then go to the next level. Every tooth in your mouth sits on a different acupuncture meridian. And all the teeth in your mouth, I have a chart in my office that was created by Dr. Vole, who's one of the heroes in our world. He passed away probably in the 1950s, but he's one of the fathers of the fields of integrative medicine. I mean, every tooth is connected to a different organ. And I have people that come in and they tell me their problem, and I say, do you have any root canals in your mouth? And I got to tell you that 80% of them will say, yep, I got one. And I say, which tooth? I said, wait, let me tell you which tooth. I said, what's wrong with you? And then we go in and we look at the chart, and it turns out they're having liver problems. So the third tooth from the midline is called your eye teeth or your liver teeth. And you go in there and you find out they either have a cavity or a root canal in that tooth. Mercury fillings are almost as bad as root canals, and they have corroded fillings. And we do a process in our office called thermograms, which is a heat-sensing imaging device. And you look on the thermogram and you see that they've got a red or a hot spot right where that root canal is, and that's when you send the patient to a biological dentist. I mean, the guy you're having on the show, if he really calls himself a biological dentist, is part of an elite fraternity of only about 100 of them. And that's how many there are in the whole United States. I've never had a root canal, but I ended up having wisdom teeth extracted that created what's called cavitation infections, which is what you get from root canals. And it like lowered my blood pressure. It was on my very back teeth, which are the teeth connected to the acupuncture meridian that goes to your heart. And it changed my life. Really, really did, just by cleaning out a socket of a tooth that had been allowed to fester and cause a jawbone infection.
When you talk about the dangers of root canals that have happened over many, many years, are there safer alternatives now if we're in a position where we need something like that, where we have a dead tooth?
Very definitely, yeah. I'm giving a talk in a few months called Advance to the Rear, because in the past there was a technology that took care of those problems. It was called extraction. I mean, if you've got a ruptured appendix, you're going to fill it with wax and put a gold crown on it? You got the same bacteria there, only the ones in the mouth may be worse. You remove it. And then the thing I can't understand, patients 50 years ago understood if you had a tooth removed, you have a partial denture, you have a bridge, you have something put in there. Today, almost anybody that I mentioned, root canal teeth, do root canal teeth, the question is, do all root canal teeth have to be removed? And the answer is no, only in those people who are interested in their health. If they're interested in their health, they can do what we did 50 years ago. Take the tooth out. Only dentists are taught to leave the membrane, the periodontal ligament, in place, in the bone, which is like delivering a baby and leaving the placenta in. Not good. But if you do it properly, if there are a series of procedures that need to be done, you don't just take hold of it and yank it out. Few other procedures, because as soon as the dentist touches the tooth with cold steel, which means the forceps, bacteria in the bloodstream going where? Every place blood goes. You poke your finger, you get blood. Big toe, you get blood. So it can go anywhere and everywhere, and does. But the bacteria have something called chemotaxis. It's a magnetic attraction, a fatal attraction, if you would, for specific tissues. Some bacteria like the heart, some like the liver, some like the lungs, some like the brain, but they have access to the whole body. So if you're interested in health, you don't just go to a dentist and say it hurts and take it out. But this kind of leads up to a case I was involved in not too long ago, where a fellow had his root canals taken out and he had some plastic temporary bridges put in. And this was done in another country, actually. And one tooth kind of began to get a little sore. And I said, okay, close down very, very slowly. Where do you hit? Well, on that tooth first. I said, okay, so the temporary is a little high. It takes the dentist, and then the teeth will come together the way they're supposed to. So I called a dentist I knew, and I said, would you just adjust the bite there? Yeah, sure, fine, send him in, that's okay. So he calls for an appointment, and the secretary says, well, what ails? Well, I got this tooth, it's kind of sensitive, and I bite down and said, oh, you need a root canal. I'll go ahead and schedule you for a root canal. Well, he had just had 5 root canals taken out because he had some real severe problems and he was coming out of them, and he understood very well that the root canals had created these problems. There is no way he's going to get a root. He says, no, I think the bite needs to be adjusted. He says, no, I'm quite sure you need a root canal. Go ahead and come in and see the doctor and we'll do the root canal. So why do we need root canals? Quota. That's not very diagnostic when a secretary on the telephone says, you need a root canal, I will schedule you for it, and the doctor will do it whether he looks in the mouth first or not. It's just, am I getting a little biased there? I guess I am, because the only people I talk to are the ones who have problems and who did not have problems before they had the dentistry done. So my objective now is to inform the public, because I tried to, well, I did inform the Dental Association about mercury, and that seemed to alter my life a whole lot. And I'm not going through that again. They took everything I had. I don't have anything to lose now, so I'm not afraid to tell the truth. I was interviewed by a religious station not too long ago, and the guy said, do you mind if I start the program off with a prayer? I said, no, that's fine by me. You know, I know the guy up there. He's okay, so you can talk to him. So he gave this prayer, and it ended with, teach us that, what is the quotation? Something about, find the truth and it shall make you free. And I said, do you mind if I add the Huggins twist to that? And he said, no, go right ahead. And I said, speak the truth and it sets you in the crosshairs. So this is what I am beginning now, having a massive amount of data instead of just 12 cases that I took to the Dental Association. I have a massive amount of data now on the frequency at which these bacteria are found, the data from the literature that explains what these bacteria do, and connecting the blood chemistries, the symptoms, and the dentistry. And then we have developed a technology that's a little bit complex. But 40 years ago, I made a lot of mistakes in trying to treat people for dental toxicity. I don't make those mistakes anymore. I teach dentists how to do it without making those mistakes and using the blood chemistry as a guide to how do you treat the patient. Is there a specific treatment? Yeah. From Tom, Dick, and Harry, we have 3 different treatments. Who tells me how to do it? Their blood.